So whenever I speak about occupational therapy, I like to introduce exactly what OT does, because oftentimes people will think I'm getting them a job. So when we're working with clients with ALS, we're going to be looking at enhancing and maximizing someone's function, or basically looking at tasks that they are required to do, really want to do, or need to do, and making them as independent, patients as independent and as safe in those activities as possible. What we have here is a circle of care with our clients who have ALS in the center there. And I just have you note that there's so many people involved in caring for patients with ALS, many healthcare and medical providers, but also you'll see big bubbles with caregivers and family and friends. We want to have them as part of the team as well. Okay, so what do we treat? First things we're going to ask about is how you're actually doing these activities that are required every day. They are called ADLs, or activities of daily living. And we may work on trying to find ways to do those a little easier by coming up with some strategies or different ways. But we also might address adaptive equipment needs, things that can be brought in to help the way we change the activity to make things a little easier. We are addressing a lot of upper extremity function, because typically when you're doing an activity, we're using our hands and our arms, so that comes into play quite a bit. Along that same lines, depending on what impact the diagnosis is having with our arms, we're going to look at positioning and splinting to help improve comfort and positioning, reduce pain and injury, and then also maximize that function for someone. Energy management. This diagnosis both impacts muscular energy or fatigue. You get general fatigue from maybe having to work harder to complete a task. And then also just neurological fatigue can be impacted. So it is something that's important to address as well. Driving adaptations. I am not a certified driving instructor, rehab instructor. However, I am able to give you some information and give you some guidance on whether driving is an option to continue safely. Are there adaptive types of equipment to be able to continue to drive, or even looking at how a vehicle can be modified to be able to have you as a driver or passenger when maybe you're in a wheelchair or have other adaptive equipment that you're using. And then I like this, which has been introduced into topics or presentations that I've given more recently, is just the use of assistive technology to maximize your independence. They're referred to now as electronic aids of daily living, and it's become much more accessible, very familiar with things like in our home, like Google Assist or Alexa, and I'll talk a little bit about that as well. So I might start by looking at an assessment of the upper body and the arms. Marixa mentioned that we work in an ALS center, but I also provide services in an outpatient setting, and then other occupational therapists might see you in a home health setting. And we're going to do assessments before we begin. So we're going to look at how much range of motion there is, whether it be active motion or passive motion in the arms, shoulders, head and neck, all the way to the hands. We're going to work with physical therapy, oftentimes looking at posture and positioning. And this can be in both standing, like in our pictures here, or in wheelchair positioning. We want to maximize that function for a multitude of reasons, and I'll get to in a minute. Strength, how much strength is there? Which muscles are weak? Is there imbalance of muscles with movement? And we want to be able to address that very clearly, as well as looking at the muscle tone, which can influence your strength. If there's a weakness in the muscle tone, it would be more flaccid, or a lot of times people can have weakness but also have spasticity in the muscle, which is a signal being sent from the brain to increase that muscle tone. So you would have spasms or cramping that might make it more difficult for someone to use their arms. And then finally, the actual putting it all together for gross motor or fine motor coordination. And this is where we have that dexterity to be able to utilize our hands to pick up small objects or be able to reach overhead. Okay, so now on to treatment. Mentioned weakness in muscles, so we want to address strengthening. A strength program is really important. Stretching is very important. And these are things that we want to work in conjunction, again, with physical therapy, sometimes speech therapy as well for muscles of the head and neck to maximize. It does not matter if there is weakness, so much weakness that the limb cannot be activated actively. We want to make sure that we keep those joints, even if they're passively moving with assistance, keeping them nice and mobile. We'll address the gross and fine motor coordination skills or the dexterity to be able to address function, and there's lots of different exercises and techniques we can use for that. Strategies for maintaining or maximizing, managing that spasticity or tightness in the muscles. And we can do this, stretching is one of the most important, so that's probably why it's at the top of the list. Daily stretching is important, but also doing things like weight bearing or positioning, or if you see in the picture there, I have someone's arm being zipped up into a big airbag, and that helps to give both pressure to relax the muscles as well as maximize the ability for movement of a particular joint. So lots of different strategies for that. We typically are staying with lighter weights. If you see in the other pictures there, we have a lightweight wrist cuff. We have lightweight resistive bands. And again, there's an particular exercise protocol that we want you to follow, so it'll be individualized to the person. But then there may be even times when people have to just work with their own body weight against gravity to do their resistive training, which is also fine. And then just to mention that oftentimes swelling can occur in either limbs of the lower body or the upper body. And Marixa mentioned that I do work with lymphedema, so I would address that for both upper and lower body, but also physical therapists might be involved in this if you're at a different clinic as well. And that really is so that we can maintain, it may improve balance, it may improve skin integrity, and just make a lighter limb to be able to function more easily. So some of the things that we can do as far as positioning to maximize the upper extremity, we'll utilize either very functional splints, and these are splints that can be worn during the day to maximize your function. For instance, if a thumb becomes too weak to be able to hold on to things or be able to pinch things, we can put it in a position so that you can still do pinching, and we have opposition, so then you've improved to be able to actually pick things up. Whereas if you didn't have the splint on, you would not be able to, or it would be awkward. So I have 2 thumb splints up there. Wrist splints are often used because maybe there's some weakness in the wrist. Sometimes people will have complete weakness at the wrist where it becomes a wrist drop, or maybe it's just we have you wear a wrist splint to give support if the muscles are fatigued or tired. That gives you more the ability to practice more in an activity if they're not getting so tired. And then at the bottom there, that would be more of a rest time splint. It's literally called a resting hand splint. Keeps your hand in a good position, and you would wear those for longer periods of time to get a nice stretch to the muscles so that when you're ready to function and use those hands, they'll be nice and limber. Continuing on with some positioning options. When we're working with patients, for instance, who are getting fit for a wheelchair, we have different options for the upper extremity. We want to make sure that your upper body is in a really good position so that you can function with your arms. So in the wheelchair there with a lap tray, the gentleman has a lap tray across, he has now the ability to rest his arms, less fatiguing, and he also has a space right in front of him that he'll be able to use his hands or use a device right there and have his hands easily be able to access it. On the other side, we have a trough. Maybe the arms have become too weak, but we don't want to end up having them just curled onto your lap. We want them positioned upright so that you get good postural alignment, important for respiration, as well as reducing pain and just improving that position, maintaining range. The fancy pillow wedge that the gentleman has with his arm up on, We can work to positioning in sleeping in bed, or even in a recliner or couch. Oftentimes it's just to use to maybe multiple pillows in bed to keep you positioned, or wedges, or we can get a little fancy and have a particular style of pillow to position. And then if, for instance, someone has a lot of weakness in the shoulder, that's a shoulder sling that can be worn, especially when somebody is still ambulating, but they have a very weak arm or even two very weak arms. That can really throw off your balance when you're walking. It also can become very painful for the shoulder. So this helps to bring the shoulder back together, keep it in proper alignment, and then again, also have the benefit of helping when the person is ambulating. Okay, energy conservation. So I've spoken for hour-long presentations on energy conservation. There are lots of tricks and strategies, very individualized to each person as well, and what kinds of functions they want to be able to complete. But I thought I would at least introduce today the 4 Ps, which are focusing on energy conservation and helping you to kind of have that memory of what were those 4 Ps again. The first one is prioritizing, and that is very important, especially with this diagnosis. We want to maximize function, prioritize what's important to you. If you know you only have a certain amount of energy for that whole day, you want to spend that energy and time on things that you enjoy, that bring quality of life to you. So if it's, if you want to enjoy cooking in the evening or family time in the evening, then maybe not spend time schlepping the garbage cans to the curb, which can take up a lot of energy for someone, and see if you can get some help, delegate to others, then maybe you can help them with other tasks as well. Planning ahead is also very important. Anytime we are rushing, both mentally and physically, you're going to use more energy. So thinking about things in advance, planning your day in advance, thinking about your week in advance and how much energy you need, as well as just laying out your clothes the night before can make it a lot less stressful in the morning, and you'll move more fluidly to get ready, saving energy. Pacing yourself. This goes along with the exercise programs as well. We look at more intermittent activity. So you're going to do an activity before you get exhausted. You stop prior to that, get a little rest, break the activities into smaller chunks, and you'll do better to be able to extend that energy throughout the day. Always saying, listen to your body. If it's telling you that you're tired, it means it's time to rest. Try not to just push through that activity. And sometimes that actually needs some planning as well in advance. And then we encourage naps if needed. They recommend nothing over 2 hours, because then that can really mess with the sleep cycle at night. And we need you to sleep and get good rest at night as well. Positioning is also important for fatigue management. I just mentioned some of those things and how they can, some of those devices and how they can help, but also proper alignment is going to allow you to have good upper body alignment and give you good deep breaths, with lung function being maximized in a good upright position. This can also be the position in which you complete a task. For instance, sitting to fold laundry is going to save you a lot of energy, because our leg muscles use up a good bit of our energy, and you can save up to 40% just by sitting to complete a task versus doing it in standing, which you might more traditionally do. Electronic aids of daily living. I think this is such an exciting topic. All of these items, your bedding, your chair, video, audio-visual equipment, music, TV, security. You can even answer your doorbell and open the lock to allow someone to come in from another room. So a lot, or turn down your air conditioning if you're hot in the bed at night. So a lot of these things can be accessed very easily, and remember that they can be accessed differently as well. We can start by using just an application on your phone. We can do voice recognition. If we have augmentative communication devices that maybe speech has for us, then we can do eye gaze. We can do predictive text to be able to engage with these different devices. So it's really come a long way. Keep them in mind. They've also become very less expensive in this day and age, and so it's really important to maximize that independence in your environment. Oops. Okay. And the last part here, I want to discuss some of the different types of equipment. I talked about how activities of daily living can be modified. We can find different ways to do things. We can find strategies to do things. But there's also great pieces of equipment to help with maximizing your function. One of the big things I think about is if a hand is becoming weak and you can't get a full grip on an item, it's good to have a wider, the bigger diameter that you're grabbing, it requires less strength. You can still be able to utilize that item without having to have a hard grip. So they have things like built-up foam. Those can be put on different types of devices, toothbrushes, utensils, writing devices. But you can also use, on the blue plate there, the gentleman has what's called a universal cuff. So if hand function becomes, or finger function becomes just too weak, but you still have good enough movement to bring a fork to your mouth to feed yourself, you can utilize that. It has a little pocket, and you can put equipment in that pocket so that you don't have to maintain a grip on it. Hydration is very important, so I would tell you that using anything that will allow you to easily get to your drink, a long straw, a Camelback, something that's very accessible to keep your hydration is really important. And then the last one there is the Ubi feeder. So it's a self-feeder, giving that patient complete independence in how they feed themselves without having to have a caregiver do it for them. Bathrooms are a very long conversation. Everybody's home is different. So I know that a lot of people will consider home modifications. And my biggest recommendation is make sure you're talking to a contractor who has some experience. We've had lots of nightmare stories where it gets redone, but maybe they still include a lip, or it's too small, or they build in a chair that's not easily used. So talking to people, we want a nice barrier-free entrance to the shower, lots of grab bars, and then other equipment can be added, for instance, the shower chair or a bench. And then just simpler things like using push bottle for shampoo, conditioner, body soap. That's going to make it a lot easier than dropping the soap and trying to maintain that in your hands, or having to squeeze bottles and turn them upside down. So lots of different options here, but introducing them quickly. Other options, for instance, dressing and grooming. The big one that I like, and I put in the center there, is the toothbrush. We talk about toothbrushes. An electric toothbrush has a bigger grip on it, so it makes it easier to hold. It also does the work for you, and it is dentist recommended. So that's the first step I go to. There are also hands-free units, which I've heard varying reports, reviews of what people like in those. But that allows you to just put form in your mouth and brush your teeth. There are a plethora of different types of activity or equipment that can help you with dressing, with grooming. A hairdryer holder, gentlemen starting to use electric razors versus a disposable razor, button hook aids, zipper aids, adapted clothing, slip-on shoes, the list goes on. And again, very customized to what each person needs. So it is a good idea to work with an occupational therapist or somebody in your healthcare team to find what's right for you. I did mention earlier about adaptive driving. Again, I'm not the expert in that, but I did want to introduce that there are options. For instance, a left foot accelerator if the right limb is a little weaker, or if both limbs are weak and the upper body is still functioning well, you can use hand controls. And then, again, not the expert in conversion vans or how you want to set up to continue to drive if, for instance, you're in a power wheelchair, or even using other adaptive equipment. I am involved in directing you to the right providers for that. And I guess I want to end here with an example of our clinic that we are the occupational physical therapist and speech therapist at this clinic, and we also are so lucky to have a facility dog at our center, both in the outpatient, and he also comes to clinic visits too. He's great to work with our patients for exercise, getting involved in treatment, but also a wonderful lover. He loves attention, he loves loves, he loves to be pet, and works with our patients oftentimes, which can be very motivating. So That's the end for me. If you have any questions, I can answer some now. Also, we'll be in the learning lab later. There's going to be occupational therapy, speech therapy, all the team members here on our center's list. So please stop by if you have any. Again, it's very specific, so stop by if you have particular questions that you're interested in for equipment. Maybe we can guide you. And if anybody does have questions, it looks like we have mics.
Hi, I'm terrified about exercise, that I'm going to wear myself out or make the muscle go away quicker. How do we know that using the hand weights and such are good and not using our energy too quick?
That's a very good question. And I can tell you that our recommendations are that we want to use light weights. We want to have a certain amount of repetitions that you'll be able to do. You want to push yourself and prior to that point of fatigue. And also thinking about, you might want to do multiple exercises. So you want to save some energy for the other ones. What I would recommend is really get in with either an OT or a PT, because they can also work with lower body exercises, just to give you that kind of protocol and give you some insight on where you should start. You're right, though, that is we don't want to overdo it. You shouldn't be doing an exercise program and feel exhausted for the rest of the day. If you should feel a little tired, maybe 30 to 45 minutes, but after that, you should feel like you're back to baseline in recovery. But as Marexa once told me, if it moves, move it. And I like that a lot. Yes.
Thank you. Hi, my name is Bud. My question regards upper body stability or upper body. Mine just collapses unless I support it some way. So, and I've tried several different braces. So I guess I'm wondering if there's anything particular that you have or are working on that would be suitable for keeping the upper body.
Gotcha. Yes. I'm trying to see what you're positioned in right now. Sometimes it's a matter of the seating, that if someone is in, say, a power chair, or people like to stay in scooters or smaller wheelchairs, they feel like they may be more accessible. But actually the base of a power wheelchair is the same width and is actually a little more maneuverable. And the beauty of that is we can have a custom-made seat for the back that fits you comfortably. It will allow you to stay more upright and in a better position, have headrest, shoulders can reach back, good arm positioning, and that really helps for someone to keep upright. If, say, for instance, well, I still walk and you can have the power chair and still get up and move around as well, too. We don't want to confine you to that chair all the time. But there are different types of slings that I might use. Figure 8 splint, which would help to kind of pull, once you pull the shoulder in the upright position or the upper body, the rest of the body goes with it. So you get more of a lumbar curve rather than a C curve. So if we get upper body up and back, then everything starts to go back a little bit. I sometimes even use taping with patients to train those muscles to be in a better position too. But again, come in for physical therapy, occupational therapy, reach out, and that's a good way to customize for you what you need. Oh, gotcha.
Hi, I'm here with my husband. He was diagnosed last year with ALS. And the minute, I don't know if you can answer this question or not, but the minute that they found out that he was diagnosed, they took his driver's license away.
Oh.
And it's really bugged the heck out of him. All those years of driving, and now he can't get behind the wheel and run around.
So I will say that's not typically the first, and it depends on how, with the diagnosis, how progressive it was or how quickly there were changes. We always try to keep people as independent as possible. I think in a big, large community like Orlando, where we don't have as much easily accessible community transportation, people really need to and want to maintain that skill of driving as long as possible. And so that's our goal.
Yeah.
Utilizing equipment, trying to keep people as independent as possible.
Yeah,
However, at some point down the line, it might become that it's going to be unsafe for you or for other drivers on the road. So that's when we have a team decision, and it really, we discuss at clinic the approach that we want to go with. Yeah, that's hard. One more? Okay.
When you were talking about independence, I'm here with my sister Jane, and Jane stays home part of the day all by herself. There is a new thing that we found. We've totally automated her home.
Love it.
But she now has the ability to go inside and out to the patio because we found a company that will automate your sliding glass doors.
Isn't that awesome?
Which is pretty cool. She has a dog tag on her power wheelchair, and as she approaches it, it just automatically opens. It will stay open for any amount of time that you program it for, and then it closes behind her. So it's a great way to keep your independence.
It is. So once you're maybe safely positioned in your chair, you have total control you can have total control of that house, that smart house. Yeah, that's fantastic. I hadn't heard of that one. I've seen the ones for the front door, regular swinging, but that's great.
If you see it on Amazon, that is not the one that you want.
Okay, good to know.
Trust me. It's by the same company, but we had to return that one, and they have a company that will come in and do it and install the proper one that is by a belt.
Wonderful.
Works, and it's all hidden. It's very nice.
And what you're sharing here is really important too. I know that this becomes like a community and a family, and little things like that we might not have heard of, and technology growing so fast, that's a great way to share your knowledge too.
And I believe it's called Auto Slide.
Auto Slide, that's an easy one.
Auto Slide. Yeah.
Great. Looks like it. What time are we? Ooh. We're moving along. Again, if you have questions, stop by the Learning Lab later and we can chat to more specific items that would be beneficial.